In this country, shipments of one vaccine are reportedly being suspended, while another is getting closer to use in teens. As the CDC reports, just over 172 million Americans have now had at least one vaccine dosed. Let's get more from Miguel Almaguer.
Tonight, we now know the U.S. telling a vaccine maker no more doses. Authorities reportedly suspending new Johnson & Johnson shipments just after the FDA extended the shelf life for surplus vials from 3 to 4.5 months, as potentially millions of doses were getting close to their expiration dates. It comes as Moderna is likely days away from becoming the second drug maker to offer its vaccine to children 12 to 17 years old. Seeking emergency use authorization, authorities hope the vaccine can help bolster low inoculation rates for kids.
Second dose, baby.
Vaccine supply isn't the problem. Today at Indiana University, a small but symbolic protest.
I think we're moving into a medical dictatorship.
Across the nation, more are fighting mandatory vaccinations.
That's backing us into a corner, and many don't want to have to make that choice.
At IU Health in Indianapolis, some employees are rejecting vaccination requirements. At Houston Methodist, 178 healthcare workers were suspended for refusing vaccines. Our Morgan Chesky is there.
You're willing to lose your job over this?
Yes.
Tell me why.
Because I am not going to take that vaccine.
One survey finds nearly 20% of healthcare workers don't plan to get vaccinated. The reasons vary.
It's inexcusable ethically that you would put your own desire to have a choice or to have liberty ahead of what's best for your patients.
In other COVID news, the CDC is also investigating a higher number of cases than expected of heart inflammation in people under 30 who were vaccinated. But it's important to remember, of the more than 200 cases, the vast majority fully recovered. Lester?
All right, Miguel Almaguer, thank you. I talked about the vaccination struggle with the White House COVID response coordinator Jeffrey Zients earlier, but we started with the president's announcement of those 500 million vaccine doses that the U.S. has earmarked for poor countries. This is a big commitment the administration is making to get vaccines out to much of the world. But this rollout's going to take you into next year. Is it enough? Is the timing going to work out?
Well, it's an extraordinary commitment. It's without any precedent. It's far and away the largest purchase, 500 million doses purchased by the U.S. to be donated to the 100 lowest income countries in the world. Those doses will start to be manufactured in August, and we will have plans to get them immediately out to countries with plans to then get shots in arms.
It's beginning to look like it's going to be a challenge for the president to meet that 70% goal, 70% of Americans, adults with at least one shot in their arms. Why is it so challenging?
Well, we're at 64%, and we got a few weeks to go to July 4th. We're doing everything we can to make it as easy as possible for Americans to get vaccinated. You know, no appointments, so you can just walk up and get a shot. And I encourage anyone who's not vaccinated to get vaccinated as soon as possible.
And let me ask you about these reports of heart inflammation cases among some between 16 and 24 who've received Moderna, also the Pfizer vaccine. Is that a potential showstopper?
You know, on all science and medical questions, we turn to our medical advisors, and Dr. Fauci recommends that people get vaccinated. Obviously, people should consult with their doctor or their health professional if they have any questions.